Hello, so I'm going to be listing and explaining all of the terms on this skeleton. It's the closest thing I had to a doll, so I hope this works. So I'll start with the anterior part of the body. If you look at it this way, the anterior would be this half and the posterior would be this half. So the posterior side is the back side, the anterior side is the front side. What's next? The superior is going to be towards the head, so it'd be like this way. Inferior would just be going towards the tail, so it's down this way. So proximal, that would be closer to the point of origin. So the elbow is proximal to the wrist, and distal means farther away. So the hand is distal to the elbow. Medial would be closer to the midline, and the midline goes like this, directly down the center of the body. So right in the middle of the head, through the sternum, straight down. Lateral would be farther away from the midline. Excuse me. So lateral would be going this way, like farther away from the body, and medial would be going towards it this way. Superficial, I was trying to think of the best way to explain this. Superficial would be closer to the top layer of the skin, so the epidermis, and then deep would be farther down, so maybe the dermis or the hypodermis, so deeper down in the tissue. Okay, so next I'll be discussing the planes of section, and if I look down, I'm just looking at my little list of stuff. So the first one I'll talk about is the sagittal plane, and there's two main types of sagittal plane. The first is the mid-sagittal section, and it basically cuts straight down the middle. So it would be like this, straight down the middle, right through the sternum, pelvis, everything. And then the parasagittal section would be just slightly off center. So it wouldn't be an equal cut. It might be slightly over here, or it could be slightly this way. It wouldn't go straight through the nose like the mid-sagittal section would. The frontal plane is, let's see, the best way to describe this would be this way. So if you could draw a line directly, this way. So your brain section would be split right here instead of here like the sagittal sections, if that makes sense. And the transverse planes. These are just horizontal sections anywhere. Here of the brain, here, anywhere down this way. So the line would just be like this all the way through. So next I'll be showing you the 4 quadrants of the thoracic cavity. So it goes by the patient's left or right, not the healthcare provider. So this is the left upper quadrant, the right upper quadrant, the left lower quadrant, and the right lower quadrant. Next, I'll be talking about the abdominopelvic cavity and the 9 regions. So this will be a little bit harder to explain because there are a lot of them. So I'm just going to try my best. So I'll start with the middle sections. So we start up here with the epigastric region. Then we have the umbilical region closer to the middle. And then the hypogastric region, which is lower down in the abdominal cavity. On the left side, we have the left hypochondriac region, the left lumbar region, and the left iliac region right in here. And then it would be the same on the right side, so the right hypochondriac region, the right lumbar region, and the right iliac region right here. So it's cut into just 3 sections like this, and it's just this abdominal area right here. Alright, and the last thing that I will be talking about is the axial and appendicular regions. So the appendicular regions are just the upper limbs and the lower limbs, the legs, and then the axial region would be head, neck, and trunk. So this area, if that makes sense.